So good afternoon, everyone, and welcome to today's webinar. We must admit that today has really changed medicine as we know it. And telemedicine amidst the global pandemic is changing everything. And so physicians don't want to deal with complicated technology. We recognize that. And so what we wanted to do was to share today how to uncomplicate it for you and the ways in which patients are also learning about this. And so this international panel is going to be helping us with that. And first up, we have Dr. Naila Siddiqui Kamal, who is really a good friend, and she is a fellow of the Royal College of Obstetricians and Gynecologists. She has been clinically active within the UK NHS for the last 28 years, and she has several higher education qualifications, including a master's in medical education and a certificate in patient safety, quality, informatics, and leadership. She has held senior positions at various levels, and she has inventor status with the Imperial College of London for her work in developing an interactive learning resource using disruptive technologies. She has won several awards, including the Distinguished Teacher Award and Excellent Teacher Award from the Imperial College, Highly Commendable Award from the Health Education in England. And Dr. Naila has led on challenging digital transformation management projects where often disruptive technologies have been introduced. We're really privileged to have her this afternoon with us. And so she's going to join us to talk about how telehealth is, why now? The time is now for telemedicine, why? And the role of technology in the current global crisis. Now I'm gonna hand over to Dr. Naila as she addresses us on that topic.
Thank you very much, Valerie, for that really very humbling introduction, and it's a pleasure to be here on the forum. So thank you so much, and that introduction, I'd just like to elaborate that yes, I'm a senior lecturer at Imperial. That has given me an opportunity to be involved with the cutting edge technology that exists both in the clinical side as well in education. And here I just wanted to highlight some of the things that we have been doing, such as using holograms in our teaching and robotics in delivery of healthcare. With that backdrop, I would like to present to you basically two things. One is my presentation is going to be first part is going to be on the clinical crisis or the health crisis that we are facing at this moment in time. And the second part is going to be the technology aspect of it and how technology has helped and developed in the last few years, in fact, a whole decade. And secondly, in this particular moment, with the COVID-19 crisis, how technology is helping us. So just giving a little bit of history on the coronavirus pandemic, how it emerged, and how it is being related to various different pandemics over the years. I find this infographic extremely helpful, although it's very small print for the viewers. Like highlights in our generation or our parents or our grandparents' generation. My mother, and she, who's 86 at the moment, and she can recall when her father used to quote what I think must have been the Spanish flu, where people were told exactly the same thing, that to stay at home and isolation and massive count of human life lost. So it is not that pandemics haven't happened over the years, but because it is happening in our lifetime and the devastation that we are seeing with loss of life, and as well as we are seeing another thing, which is that innovation is coming into practice at a record speed. What used to be, what used to take years from initial thought to a reality is now happening within days, if not ours. The coronavirus pandemic timeline, when it was first reported on the December the 31st, so imagine that on the 1st of January onwards to what we are now, I think it's the 8th or the 9th of April, so within 3 months, if we reflect on how the world has been brought, the healthcare system, most advanced countries are facing such massive challenges in just maintaining normal levels of healthcare delivery. We see the eruption of emergency wards. We see big stadiums being converted into hospitals and ICUs. This is unprecedented. The important thing as clinicians, this is extremely, frightening for us as clinicians, is that it seems to be, mutating. There's talk that there might be a second or third wave. So I think this whole experience that we've had so far, we should learn some lessons very quickly, and that is one of the reasons why such webinars as we have today are extremely helpful in raising awareness as well as to plan ahead. If you go to this website, which is Worldometer, it can actually give you the granularity of information as to exact location, the country, as well as particular sites where coronavirus cases are being reported, how many deaths, how many active cases, and how many closed cases. So as you can see, nearly 1 million deaths so far, and these are the ones which have been reported. We have to be wary of there are many parts of the world where really robust reporting does not happen. So we don't know whether it is tip of the iceberg. So having set the scene with regards to the clinical crisis, let's just move on to where technology is at the moment. Especially over the last few years. And then I will come to how technology is playing its role with dealing with Corona and its aftermath. So I quote here from a report from Deloitte Health Tech, who have shared some insights as to the healthcare sector, that healthcare technology sector, first of all, is $1 trillion industry. Over the last few decades, this is just like a avalanche that has erupted, or a volcano that has erupted. You see companies who were never into technology, in healthcare technology, or into healthcare sector, because they realize that this is a huge industry that is needed, as well as it's got a very lucrative business model. So technology really emphasizes on 3 areas in healthcare: enhancement of quality in healthcare, reduction of waste, and improvement of care. So how does it enhance behavioral change? So patient engagement. We still have an older generation of patients who were more tech, reluctant to use technology, but these are sometimes considered as myths. I can give you a personal experience that I've got an 86-year-old mother who's very savvy with her iPad and Skype, because it's a necessity. The family is now globally scattered all over the place, and in order to be in touch, this is the best way. So people adapt and adopt, and it is not age. Some people say it's cultural or age resistance. Once the necessity is recognized, behavioral change does happen. Patient experience is at the bottom of it. Now patients' role is quite changed in our delivery of healthcare. While as previously being a passive receiver of healthcare, the patient has moved towards an active, partner in delivery of healthcare, and has got an equally important role in demanding the quality or a healthcare which is bespoke to their need. Especially medicine adherence is a big issue. If we were to delve into how much medicine non-compliance leads to disease, what do you call, poor management of disease, especially in conditions such as HIV, chronic conditions such as diabetes, heart conditions, where non-compliance to medicines can really have a huge human as well as financial cost. So that brings us to the second thing which healthcare is focusing on, which is take out the waste systems. And electronic medical records, which we are going to touch upon in a minute, as well as delivery systems, is an important tool, a platform which has been created in order to prevent the unnecessary wastage, and also to use the human resource in a better way. For example, previously, and I think in a lot of places in the world still exists, where paper documentation of patient records. That means you have to have people to maintain that. You have to have people who have to transcript those things and have to keep the records in a safe place. All that leads to an additional cost, when we can have a simple solution, which is an electronic medical record system, which, if it is catered to the needs of a particular system or healthcare provider, you have all the information at the tips of your physician, of the commissioners, of the insurance companies, hence makes it very seamless. And access is important. Now, the part of access that I wanted to emphasize in today's situation is virtual care. So for example, in the NHS, we have a lot of elderly, 3/4 of our patients are elderly. So having them to be brought into hospitals or from care homes is not only a poor experience for the patient, but it's got a huge amount of cost associated with it. So what we've done is we've created virtual wards. What virtual wards means is there's a team who goes and visits these patients who are within their own homes, and they are actually enrolled or are admitted to a virtual ward where they have a bespoke or a named team who's looking after them. Similarly, virtual clinics and telemedicine is a very important aspect of that, which we are going to be talking about. Just to give you a context of the how technology has really taken shape to date, we are almost well established in the 5th industrial revolution. The first being, when steam engine, in the days of the steam engine and water power. The second being mass production of cars and assembly lines. Third was, the computer. I still remember when I did my thesis for my MRCOG, and on a computer, it was a big, bulky, piece of equipment, and we used to have the floppy disk. And then moving on to the cyber physical systems, further on the machines, machine learning. So the 5th industrial revolution is the machine learning aspect of it. That means machines making decisions. And this is the very exciting and often controversial part. People don't understand, and sometimes our own clinician peers think that, oh, are you going to make machines make decisions on patients? It's not like that. It's actually humans who feed in algorithms into the machine, and thus those tasks that repetitive tasks that humans have to do can be taken over by machines, and a higher level of that is machines making decisions. We are already seeing this in many aspects of our lives without realizing. For example, your phone with its navigation and its information that it connects. For example, I go to a clinic in one part of the city 4 days. On the 5th day, my phone automatically gives me the traffic update on because it has recognized that on the 5th day, on a Friday, I go to another hospital. So this is all that machine data collects on itself, and machine make decision. It would take a long time if I was to elaborate on how many different types of technologies we we've got augmented reality, artificial intelligence, automation, which is obviously the robots, um, uh, big data, and so on and so forth. The World Economic Forum on its website has got a very interactive tool, and I would really encourage people to go and visit it. And it is a state-of-the-art tool that I think highlights all the important connections to any particular field. And the future of health and healthcare, it has got these 5 or 6 important links, and technology is at the heart of it. And how we deliver a technology-enabled healthcare is going to be totally different as we know it from history. Just to give an idea what people mean when they say smart cities and smart healthcare system, it's all about connectivity. This infographic, I'm not going to go into detail, but it's everything is connected, and everything is connected in a way that it is seamlessly delivering whatever function. So it's not really dependent on many factors which can let us down. One can argue that technology in itself can let us down, but we are talking in a utopic world where everything is functioning to its best ability. So for as report healthcare as we know it will not exist. And what are the 3 major areas of interconnected subtypes that we are going to be seeing more and more? First of all, data and platform. So data analytics is very important. And I'm going to come to Corona and COVID-19 pandemic as to why the world was caught off guard. We did not have data on the ground. Although we have these platforms, but behavioral change has not happened to the speed that it should have happened. And people were not inputting their own data, or which is anonymized. I'm not proposing, personal data to be shared, sort of to be taken lightly, because we all know what issues are there with data privacy and issues with data as such. But if we had on the ground reporting by people of their symptoms, and analysis of that data was happening, we would have caught this even sooner, and people would have been prepared with what is coming. Well-being and delivery with virtual and physical care will be far more on the forefront, and care enablement, which means connected health, is going to be more at the forefront. This is a prediction for 2040. And I think this was written before Corona. Everything has catapulted in such rapid speed that, we are taken by surprise. Things that used to take years now are happening so quickly. Those of you who may not have known much, or don't have that much of information about it, I think this is very nuanced. This is a good resource and a reference that I've got there, and a link down there as well, which actually gives a history of telehealth. It is not something very new. It has been used, many decades ago. 1950s and 60s is the way we see telehealth right now, where it was used in a psychiatric institute. My personal experience of using remote healthcare was actually in 2008 with Imperial, where we used Second Life. I don't know whether people are aware of Second Life. It's a platform, it's a virtual world. And people can make avatars and log in there. You will be surprised, it's not just for fun or entertainment. You've got IBM, you've got Mayo Clinic, Cleveland Clinic, Imperial. They all have an existence in virtual life. So what we did was we created a clinic for sexually transmitted infections for teenagers, this was used for especially teenagers who were reluctant to come into such clinics because of taboo areas of health. But making an avatar, they would come and we would run the clinic for them and advise them. So this is not something new. What is predicted that 5 ways of healthcare tech which have helped the COVID-19 pandemic so far, which is video consultation. So what we are going to be talking about very soon, which is telehealth, because everyone is in isolation. Even clinicians are using all the protective equipment which they can get, which I'm a little bit skeptic about. Things are not coming as quickly as possible. However, maybe, so peer to peer, I have to speak to another team who's based in another unit. So I'm using Zoom, or we've got Microsoft Teams, which we would never have thought using in the NHS until we had a lot of red tape, passed before we could even think about it. But it has been within, on Friday it was decided, on Monday we were using it. So this is the speed of change that is happening because of necessity. Robots, you can see me here. I was at Orlando last year, and this is Pepper, the first humanoid robot. Pepper is being used in pediatric wards and in pediatric healthcare delivery, doing a lot of repetitive work which can be done, and patient experience is improved as well. You've got wearables. This is an Apple app which has got so many health apps. We are all using Fitbits, which are connected with Bluetooth. So here I'm very proud to flag up our collaboration. So my organization, which is called MedRed Healthcare, who do consultancy in healthcare with Geotech Vision, and we've actually developed this COVID bot, which has got many functionalities. It's very different to the usual symptom checker that we see many people are bringing out and many countries are bringing out. Here we have not only, we consider it as a digital companion, because people are isolated and they need some kind of one-stop source of up-to-date and valid information. This is created by clinicians. Hence, it has got the latest algorithms based on the emerging literature which is coming out. So the first study that we based it on was the Lancet paper that came out of Wuhan, and it's being upgraded as new information is coming. Not only does it do symptom checking and giving a stratification of risk of being COVID, being prone to COVID infection, but also does a baseline health check. So where we are, so because the one of we discussed before developing this was the people need to take charge of their health. Gone are the days where the healthcare providers would be taking the leading role. Individuals have to take charge, because the health providers are just bent backwards now with the amount of subscription in all kind of direction that they've had to do. The bot has got other things in it as well, live analytics, and this especially I'd like to bring to the attention of those viewers who are logged in, who have an interest from a organization's point of view or healthcare point of view, because in order to look at population health with a view of identifying what is the trend, it's extremely important that we have a behavioral change and individuals use this. It's totally anonymized, there is no personal data. So this is how I see things going, that we used to have face-to-face consultation. It moved on to telehealth some years ago. Some people are more well established in it, and some are waking up to it. I think now is the time where it should become main. Personally, as a clinician, many of my peers, that we are ever going to go back to the previous model in the way we saw it. The second change which you might see, which is already happening, is holograms. These are being used in care of the elderly, where you can holoport yourself to the patient's bedside. Not going to go into details right now, because this is the next step onwards. For the technical people, this infographic may give you a little bit of understanding. So for example, you have the remote clinic on one side and a patient on one side, the ambulance people, then the investigations, such as, you know, the MRIs or CTs or whatever, and you have a clinician. And then there is cloud computing. All this can be connected, and that is what we call as an ecosystem. We don't really call it individually, you know, a telehealth system here and an app here, or you know, a hospital-based computing system. And the health ecosystem, which we should aim at, should be all connected in a way that information is free-flowing. Whether you become, God forbid, you need healthcare, whether you're in Trinidad or in Jamaica or in Florida, your information is on a cloud where it can be accessed anywhere, and you can, through telehealth, be put in touch with your favorite clinician or anyone if you need advice on anything. These are some examples just wanted to flag up, which these are well established you know, systems where we are using telehealth in management of chronic illness, and also bringing about behavioral change. Who are the stakeholders? The payers, the providers, insurance agencies, pharmaceuticals, because pharmaceuticals in particular, because they want to know where there is a deficiency or a lack of stock in any particular region, where the disease trends are going, and hence they can be prepared. For example, if we had known, if we had predicted there's going to be a respiratory disease of this scale, the pharmaceuticals would have been prepared to have those medications that we need, or the equipment such as ventilators, such as the masks in those areas equally distributed. We were caught off guard. So this is what, you know, by using these technologies. Now, latest publication in the British Medical Journal is that redemptions of video consultations. There were many skeptics within the UK healthcare system, and the speed of transformation, what I've just mentioned to you before as well. Within 2 days, there were 36,000 practices. So it is doable. You know, 36,000 practices in across within NHS means each practice has got many clinicians who are engaged with the practice. All of them converted, 80% of them converted into telehealth. What are the advantages of telehealth? Reduces variability. So for example, I've used it in a developing country where, I mean, I come from Pakistan, and we've used it there, promoted it there, where where we used a hub and spoke model for antenatal care. For example, in villages or rural areas where there are women who need, or their clinicians who are not experts, and they need advice, and they are connected through mobile telehealth vans to a center of excellence so that they can be put in contact. And there is reduction in variability of expertise, because every person has the right, every individual has got the right to the best care which is available in that particular region. And actually it's not region anymore, it's global. We are Imperial, at Imperial we are connected worldwide with our peers who need second opinion. My specialty is cancer, and we are giving, you know, expert opinion to our colleagues who are based in various parts of the world on difficult, you know, cancer patients. Access to specialized care, it's practical, relatively inexpensive, and it maximizes access, and it's set to grow. So the bottom line is, it is set to grow. My key message at the end, and this is my last slide, which seems to have disappeared, is that I would encourage everyone. I think we've invited a global audience on this webinar through my connections and Valerie's. Wherever you are, please engage in whatever healthcare technology that you have access to, or explore. There are people who are trying to make it easy, because we are all in this together. And I fear for, you know, what the unknown. So using the Johari's window, that at the moment we were caught off guard with an unknown, and if there is another unknown out there, we should be prepared with all the technical help that we can get. So I'm going to stop here, and thank you so much.
Thank you. Thank you, Dr. Naila, for your presentation. I am just going to remind the audience that we are going to have time to answer a couple questions. We're going to go to our next presenter, who will actually be demonstrating for us an application that you could start using tomorrow for your services. This is the Smart Clinics application, and Dr. Waqas Ahmed is a nephrologist and the founder and CEO of the American Telephysicians, and the physicians-led healthcare technology company, which is based in Jacksonville, Florida, and has multiple telehealth projects. And so we have partnered with, Geotech Vision has partnered with American Physicians to bring to you GTV Smart Clinics. And in this session, he will be demonstrating the Smart Clinics application for you, so you can see just how easy it is to get started. Dr. Ahmed?
Thank you, Valerie. Thank you, everyone, for being here. And thank you, Dr. Kamal. It was such an informative talk. Thanks for that. I hope you guys can hear me correctly. So it has been great, player, and I hope you can see the screen also.
Yeah, everything's good.
Awesome. So our organization is American Telephysician. We're a physician-led technology company and the healthcare organization. We call ourselves more like connected healthcare organization, where combination of expertise of physicians and the technology, how this can do wonder. And I'm so thrilled to see most of you guys being here in the same category, physicians and the IT, especially the current epidemic, what we are seeing right now. It is so challenging at how it has really reshaped, and it's already kind of doing devastating, unfortunate, devastating effects on the healthcare system, and not only plays for the patients, but also for the healthcare workers. We as a company have been running various projects in the international market as well as in the US for the last 3 years. And one of our project is Smart Clinics. That is intended to how we can help physicians to go digital. Traditionally, especially in the developing countries, it primarily has been just the paper medical records, and the patients just go to the doctor's office and seek this medical attention and get the paper script. So this whole project is based on to making them more using the electronic healthcare record, but also wherever applicable, we wanted them to use technology, video consultation, and online clinics. As Dr. Kamal was mentioning, I was certainly was being a physician, endorse that telemedicine is not just a physician to patient encounter. It has to be a complete digital healthcare ecosystem, because as a physician, we know that when we see a patient, we need to have all of their medical records before we can make a better decision for them. And once we have that, then we want patients to have labs, radiology, medications, all those things there, and then we want those results back. So it's not just a one-time encounter, it is a complete ecosystem, a 360-degree program. And that's what led us to build this whole ecosystem. And in various parts of the world, especially in the US and also in Pakistan and other, where we are running 2 projects simultaneously. One is Smart Clinic and other is the healthcare marketplace. And we were very glad to have Geotech as our partner in the Caribbean region, because we plan to have both projects with them together as we go. And I would like to kind of focus now on the Smart Clinics, especially in the current COVID-19 situation, which, as I mentioned, as a healthcare provider, it's such a challenging situation for us, because on one hand, we want to continue to take care of the patients and also continue to have operations of the clinics. But on the other hand, we don't want them to get exposed. to those patients who may be positive, or even for our own healthcare workers. And similar situation is being faced by the hospitals, where they are again not only running short of the equipment, but also the man-force powers, because a physician or any nurse staff who get positive for coronavirus, even they are not so sick, then they essentially needs to be quarantined. And that's where our smart clinic is being used in various settings, not only the clinics in the hospitals, it's also being by various non-for-profit organizations. And the whole idea is that how can we convert the existing practices, add on a clinic, or though even those physicians who even do not have an office practice, if they are thinking to start an online clinic, it's made it very easy for them. And as you can see my slides there, and I'll go ahead and with the demo as well. It's a cloud-based system and does not require any fancy infrastructure. All you need is to have the internet. Luckily, most places in the world right now do have internet, and especially the patients have these smartphones. And we created specifically the apps for our patients so they can download it and they would like to see the doctor. And on the provider side also, they can use the whole system. And so I'll go ahead and demonstrate some of the salient features of Smart Clinic, and then we'll cover the rest in the question and answer session. I had a pleasure with me to join my co-founder and chief medical officer, Dr. Khan, be joining the call with me. Because we're giving a demonstration of video on our smart clinic, I'll be stopping my video here on the Zoom. We'll be using the other one. I'll still be using a Zoom for the audio thing. All right. So the system is a smart clinic. As we said, the partnership we have with the Geotech Vision is that the idea is to have create a marketplace where physicians who are in that geographic region, they can come and log in as a provider, as a physician, and they have access to the smart clinic. Whereas the patients can also see those physicians who are in that platform, and they, based on their location, they can simply choose their location and they can find out which providers are who have subscribed to Smart Clinic. So obviously, before this whole marketplace can be launched, the first thing is that we want to have physicians who can sign up and who would like to set up their online clinic to see patients remotely and continue their existing operation, as well as the hospitals, if they would like to use this for their outpatient settings or even inpatient settings. And the third is even those physicians who are thinking to open up their clinic, they may not even office practice. They can simply log in or sign up for the online practice as well. Because once these physicians who sign up, once they are listed here, it will be very easy for patients to find them and schedule the online appointment. And the way it works on the physician side is very easy. The physicians will log in on the Smart Clinic. Each practice who signs up through the Geotech, they will be assigned a unique username and password. And once they log in, it's a cloud-based system, essentially, no plugins needed, can be accessed on any browser. We prefer Google Chrome for the enhancement and all. The first key step is they need to add patient to the practice. And each practice may have multiple physicians, and all they need to do is just fill in these 3-4 information: name, date of birth, the gender, the cell phone, and the email address. And once they do that, it creates patient and they come to the patient list. There are various packages which can be done and based on the workflow. Some physicians would like to have just do it themselves, everything. They would like to add patient, especially if a single member physician, they would like to set up their own practice. And if they do not have the ancillary staff like medical assistant, all they can do is they can simply, from there, the patient, they can simply add the start call button. And then they can, all they have to do is invite the patient, whoever the patient is. And if the patient's information is already saved, it's fine. They can use that. Or in this case, I'm going to send text message to the Dr. Khan. He will, while I'm putting his information here, which can be pre-populated at the time of when you get the patient account. And I hit, as soon as I hit the submit, the patient or whoever the recipient is will get a text message with the video link and also get the video link in the email. There is a third feature, which is the version is where if you want the call to be initiated by the medical assistant first, once she's done with the patient, they can actually see who's the consultant they would like that consultant to be part of that call as well. And they can actually just submit that. And then, as I said, the patient will get the text message. Dr. Khan, did you get a text message?
Yeah, I'm waiting. I just got my phone in my hand. Okay.
And so you must have got a text message as well as the email. And if the patient does not have an app, the message will tell them to download the app also. It's better to download the app.
I got the message now on my phone.
Okay, thank you. The patient, if they have an app on the smartphone, it just makes so much easier for them to download the app and then just connect it much easier. Of course, it does depend sometime on the bandwidth. We do have features like text messaging. Our app, we're also now producing a system where if the patient wants to talk to Dr. by the...
Yeah, to mute her.
Okay, let me mute on this one. As you said, now, if I would like to invite multi-users, I can do that also. I can, invite any family member to do a three-way call. If I would like to invite a consultant, they can do that. But if you can see my screen, the one of the big difference between many other telehealth platform, which were like, Zoom and all, that this system does provide the whole EMR system. While I'm talking to the patient or the other, I can choose my templates for the EMR system because it has a built-in EMR, and I can create the whole note. And this note I can fax it. I can also access the patient's medical record, which makes it very, very effective, especially if the patient on the other side is at another facility or the nursing home or another clinic, because the nurse on the other side or the provider on the other side, all they have to do is they can simply, before this call, whatever information they can feed in. As a physician now, I have this access already in the system there. So it can be, multi-directional visit. The key other thing, as Dr. Naila was mentioning too, we want to order all these labs, radiology, and medications through the system here. And that can be easily done from here. And we can integrate with any local labs, or at least the simple thing is just e-fax the whole prescription there. There's a whole tab for the patient education also. The system does allow you to send any educational documents or videos, especially, you know, with how the coronavirus and everything there, or whatever diabetes case may be. All the physicians, they have to do is they can upload any of the educational material they have. Patient will get that in their portal. I'm going to stop Dr. Khan the video here. Thank you. So let me show that. The other important feature with this is, especially for the Caribbean market or those market there, they don't need to have a separate EMR system. As I said, this is very customizable and robust EMR system built in there. And that is another area where we're focusing a lot on creating a whole EMR system. And down the road, if the patients are getting more tech savvy and they, you know, how they're using devices, their Bluetooth devices or smartphone, this makes a very customizable ecosystem how they can use that. The other feature, which is for the clinic, if a clinic, the practice decide that they want to actually book appointments in advance rather than, so they can do that also. It's a whole practice management system that opens up a schedule. It allows, same thing, it allows the front desk staff to kind of schedule patient's appointment. Again, once they do that, patient gets the link. They also get the reminder before the appointment. And then, of course, the doctor or provider, they can simply start the call from the appointment section. And then last but very important feature for physician is that if the patient is requesting a call back and they want that feature, the patient will be seen in the call room, and they can get from there, because as you guys saw this here, that the patients would request the appointment, and they will make appointment from here, and on the physician side, those appointments will show up on the call request there. So with that, I will stop here. Certainly we can go on from there, many things, and the future which I see is also in Caribbean is the whole ecosystem, because the other product we have is Cura4You, which will allow patients to schedule the next service, because the doctor has ordered those services, labs and radiology. This platform actually allows patients to schedule all these services with the price transparency. And so that will be a phase 2 there. Thank you so much for your time.
Thank you so much, Dr. Ahmed, for that. And so I know we've already been getting questions. We are going to take those questions. I know the time is going, but we will have some, if you stay with us, we will have a chance to answer those questions as well. And so finally, we want to just go to our next presenter. That is Janet Stewart, who is one of Canada's leading experts when it comes to designing, developing, and deploying online learning solutions. You just heard Dr. Ahmed said that you can send videos for educational purposes to your patients. So this becomes a critical element. And so Janet is going to be talking to us about how doctors can leverage e-learning in patient education. Janet, please.
Thank you, Val. So I'm going to talk about what I would call self-directed learning for patients. And yes, as we alluded to in that previous platform demonstration, the doctor has an option to send information, or to what we would say in the learning world, to push information to a patient. So really there's two types of situations I'm going to talk about. One is when a patient just goes into Google and wants to find out information on something, and the other is more receiving the information from a doctor or physician or any kind of medical organization. I'm going to share my screen. So I just picked a topic, any topic, and I went to the great Google and I put in diabetes and I did a Google search, which when you think about a patient, if they're concerned about their health or wellness in some way, they're very likely to go to the great Google, type it in and see what they get. In this case, the very first thing I got was an ad. So my first question is that legitimate information or is it going to be biased information? Is that what I would want my patient to see and click on? And then there, of course, there are other things there like Wikipedia, and there's 910 million hits. How could a patient possibly know whether any of that information was good information or not good information or biased information? So that doesn't necessarily work so well. Then I think, okay, well, in that system that we just saw, you could push information to a patient. You could say, all right, they came, they met with me about diabetes or health or any aspect of health and wellness, and now I want to send them away with some additional information, or I want to send them. When I say came and see me, I meant online, of course, but I want to send them some additional information. So I have some information handy, and I upload a document in Word or PDF, and I send it to them, and it looks something like this. I just pulled something from a project that we had done previously where we had to take some pretty dry information and turn it into something really fabulous that people could consume. So I could do that. I could just send them a straight up old Word document or even PDF it, and it's black and white text, black text on a white page. Not that exciting, but it does the job. At least now as a patient, I know, okay, my doctor thinks this is good information and I trust my doctor, so I'm going to trust this information. Well, then you could take it to the next step and apply a little bit of design to it, and it could turn it into an infographic. You could add some color, make the information make sense, some sort of flow to the information so that the patient can read through it and consume it quickly and easily and get it and understand it. You don't have to worry as much about literacy skills potentially because you use images to convey some of the information. And then I could say, okay, well, I want to take this infographic and I want to bring it to life. I don't want it to be a passive learning experience only, because so far all we've done is read information. But I want the person to be more involved and more interactive in their learning experience, because in the learning sphere, we know that when a person is involved in their learning retention rates go up, and so does comprehension. So I really care about them learning this information, consuming it, so that perhaps behavioral change will occur. And if we go back to our first theme, which was diabetes, of course, if we're pushing information to them, it's because we want them to do something differently, most likely. We maybe want them to change their diet, for example. So now we go to something like this. This is what a course looks like when it can sit on a website. There are a couple of different ways it could look, but this is one of the ones that we built for Valerie's company a little while ago, last year. And so you can see this is how a course looks. And now you see the information has movement, it has color, it has pictures, it has context. I can even build knowledge checks in there for a bit of fun to make sure that the person is getting it. I can go on to the next chapter and I can add hotspots. This could be a human body or a particular organ, and the hotspots now are things I need to click on to find out more information about that particular, in this case, it's a bird sanctuary, but it could be anything. Let your imaginations go here. And again, we have another knowledge check. We keep on going. We talked about having videos that are sent out. Well, what if the video was embedded right into this little mini course? This course, by the way, when I say course, it's a whole 10 minutes, and it's an introduction to a particular topic. Again, not a health topic in this situation, but you can see how the information now is coming to life more so than words on a page. And then, if you really want to serve your patients well, you can have something like this. This is a learning center we just launched for one of our other clients that we work with. And in this case, their area of expertise is helping startup businesses. And so you can see across the top, we've been able to actually put keywords associated with each of these mini courses that we made, so that when a person comes along and say, oh, I want to learn about branding, and I click on that, now instead of having 24 courses that I need to look at, the 3 that are most relevant come up. Or if I want to learn about incorporation, those 5 come up. Or I could just see them all. So when you think about providing your patients with an education center where they could go in and self-serve and look at the different topics that they might be interested in around health and wellness, and then do a mini course, a 10 to 15 minute interactive experience. I guarantee that that will have more desirable learning outcomes than the great Google approach to patient education. Back to you, Bob.
Thanks, Janet. All right, so I noticed that we have quite a few questions, and so I'm gonna just go directly into the questions, and you can just keep the questions coming. So the first question that I've seen here, and I think Dr. Naila might want to take this, and Dr. Ahmed, feel free to jump in. The question is, how can telemedicine be used to manage patients without the great plethora of manpower and resources in ophthalmology? Dr. Naila?
I can take it.
Hi.
Okay.
Hello.
No, yes.
Hello, can you hear me?
We're hearing you.
Okay, so my video is actually stopped, but anyway, teleophthalmology is a very established area. So, you know, like telemedicine being, you know, there for in many specialties, but in ophthalmology, one would have thought that it may not have taken its place, but especially in the UK, I'll give you one example. There is a diabetic screening program, and the compliance to the diabetic screening program was very poor. So with teleophthalmology, there are two ways it has actually helped. One is a synchronous and the other is asynchronous method. The synchronous is when there is a live patient and clinician interaction, where patient's presentation and etc. are taken into account. The asynchronous is where the data, where images, the retinal images, etc., have been pushed forward to an expert, and they are having an interaction. Let's say in a care home setting, where a patient has had their images done on a different from a different facility, maybe even high street optometrists are providing more detailed assessments, which may be easier for the patient to have rather than be taking miles away to a specialized unit. So the asynchronous one is where the clinician or the expert reviews those images and then has a one-to-one interaction with the patient and gives their recommendation. There is another model that has been used, which is, as I mentioned before, where telemetry is based on mobile units and are taken to various different facilities and connected with the expert unit. So it's, I've actually given Valerie a link to a paper on this, and if you're on chat, maybe you can share, Valerie, that link, which will give you more information. I hope that answers the question.
Dr. Ahmed, thanks, Dr. Naila. Dr. Ahmed, you had wanted to add to that?
Yeah, actually, so as Dr. Kamal was saying, it is very established entity. We do have a company in the US who's actually partnered with us for this whole teleophthalmology, and especially with the devices they have. One thing for the patient, it can be directly to the patients at home, especially when they are worried about red eye, and with all this just a smartphone, they can just show those pictures or video in live, or they can upload the pictures and those can be seen by the ophthalmologist. It's what I call a first aid. For more detail, it has to be clinic to clinic or physician to remote clinic there, because if you want patients to be examined in detail, then that clinic or facility, they may have that equipment installed, and those pictures or images can be uploaded for the ophthalmologist on the other side, wherever he may be or she may be. And it can be very useful for second opinion services as well. So we have done it practically if we do. So if anyone is interested, certainly that's an option. We can help them out.
Okay. Okay, thank you. So I'm just trying to take any other questions that there may be. Are there additional questions that persons would want to get answers to? Let me check the chat. Any questions on the Smart Clinics application? So I have a question for you, panelists. Dr. Ahmed, how long will it actually take for you to practically set up a smart clinic if somebody was interested in it?
So it depends, as you know, depends what features they want. If they want just a simple, all they want is just the video part and just small, EMR system, no customization, no branding. We can set it up in a day or two. All they have to do is just, let us know how many providers they have and name of the physicians, and we can set their practice online with the smart clinic, again with Geotech Smart Clinic Marketplace, and so they can start using it there. If someone like a bigger setup, they want to have customization or their branding, that may take few days to few weeks, a couple of weeks, based on the work or customization they want. For example, we just had a contract with a very large international organization, AIDS Health. They have operation and clinics in their 42 countries. We got a contract for their US market, and for them, we kind of making their clinics go live within 1 week, and they need more customization, so that probably may take a couple of more weeks, but it can be 1 day to 1 to 2 weeks.
All right, thank you. So another question that we have is whether is GTV Smart Clinics available now? And I can definitely answer that. The answer to that is yes. So if you contact us, yes, you can literally go live tomorrow. As I said, a day to a week. So we could have you up and running by the end of the day tomorrow. Another question that I am getting is how do you capture basic data like weight, temperature, blood pressure in a telemedicine system?
So very easy. The patient does get on their side. The patient get the portal up there. They can either enter manually, or if the systems we have, for example, doing integration with Omron blood pressure devices. In the future, we also want to integrate with the smartphone apps, which already have that data, so data can be transferred on the smart clinic. So both ways, manually or automation process can be done.
Okay, thank you. I have another another question, and this one is for Janet. What's involved in making mini courses for patient education?
Well, I can't promise to have it done by the end of tomorrow like you did, Valerie, but it also depends a little bit on what we're starting out with. If the physician or healthcare provider has some information already, then transforming it into something like what I showed you earlier is a fairly simple, it's a creative but simple process if you know what you're doing, I guess. So we take that content and then we imagine how it's best to show it, and then we design a course. The ones I showed you earlier are all built in a product called Rise. So it's a kind of a specialized software that instructional designers use, but we take any other digital assets that you might have. So if you already have some mini videos, or if not, we can send you a link and you can make those right on your desktop, especially if you're trying to show someone maybe how to use something. So there's lots of different tools that we use, but those courses, those 24 courses that I showed you in that one particular learning center, were built in about a 3 to 4 week period. And we did have content to start with. We had actually 24 1 to 5 page PDFs that we started with, and then we transformed them into those courses.
Okay, so I have another question here, and this one is, why did we create the COVID Check app? And I think Dr. Naila had started to answer that in her presentation, but I think I will just give you my take on it. As I said, it was a partnership. Geotech Vision recognized the need for this. We recognized that we were not medical folks, but we are definitely technology people. And so we reached out to a trusted medical partner, Mederet. And in so doing, we decided that we didn't just want to create something that was based on guesswork with the technology because we are able to do some amount of coding, but we wanted to actually have real information that was based on clinical studies. And so Dr. Naila and her team would have been providing us with that kind of information and actually provided a backbone behind what it was going to be. So it became a personal digital companion where it is that it not only facilitates the whole self-awareness of your baseline health status by giving you a risk score so that you can better understand what that is, but it also has a symptom checker with the relevant recommendations for your COVID-19, which was signposted to CDC and WHO website to enable individuals to act accordingly. And we also, as of the next 2 days, in 2 days' time, we are also releasing the symptom tracking, the symptom diary, which persons can actually use to track their symptom over time, as well as to do contact logging, which will allow for the whole matter of contact tracing. We believe that this would actually encourage behavioral change, the entire app, in the public, to provide them to take greater responsibility for their own health. And finally, the part where another side of Geotech Vision comes in is the whole matter of collecting the analytics. And as we said, we're not collecting any personal information, but what we're doing is understanding emerging trends in health concerns so that we can even help governments and health organizations to predict future hotspots based on the risk tracking and also other community impacts. Let me see if there are any other questions. I am not noting any further questions at this moment. So if there are no other questions, I really want to thank you for joining us this afternoon. And if there are any additional questions, please feel free to reach out to Geotech Vision. You can simply send us an email at info@geotechvision.com or ehealth@geotechvision.com, and we'd be happy to answer that for you, whether we can answer it directly or we have to liaise with our partners to give you the specific answer and the recommendations accordingly.